Hello guys, so today I'll be showing you the techniques for IV eyelets wiring. So we will require a cast for practice, then a twister, then a wire cutter, 26 gauge wires, and the most important of all, a probe to form the IV eyelet loop. So firstly take a wire and a probe to form IV loops. So we want to form a loop so that we can make an eyelet. So I'm taking the wire and putting it around the probe. Since I have a very small wire, I have taken one side of the wire small and the other side long. If you have a long wire, you can take equal length of both the sides. Take a twister to make IV loops. Now twist the wire 3 times to form a loop. So I have twist 1 time and then 2 times and 3 times. So we will twist it 3 times. So we have twisted it 3 times. And now you can see that a loop is formed. So let me zoom it to show you. You can see here there is one hole, and with twisting there are 2 wires attached. So one IV eyelet loop, that is the hole, and 2 tail ends are formed. So in this way I have formed many IV loops so that I will use in the other parts of the maxilla and the mandible. And also you can make this in advance in clinic so that you can use it in emergency procedure and you don't have to make it again. Now the 2 tail ends of the eyelet are passed through the interdental space of the 2 selected teeth from buccal to lingual side. So you can see that I have passed between the 2 molars. I will take the shorter tail, that is the shorter wire, towards the mesial side. That is, I have taken through the first molar towards the mesial side and I am entering back into the buccal side. I have pulled it. Now I have pulled the longer wire and I have pulled it towards the distal side. And this wire, I will pull the distal side of the wire through this hole, through the IV eyelet hole. So through the eyelet I will pass this wire. That is the reason why this wire should be longer. So I have passed the wire through this hole. Now twist both the wires together, thread it together, and cut the excessive wire with a wire cutter and twist it towards the gingiva. So we are done in the molar region, but in each quadrant we need 1 or 2 IV eyelet wiring. Nana hato. So you can see that I have done in the premolar and the canine region. So 2 IV eyelet are there in this quadrant. And likewise I have done 2 IV eyelet in the other quadrant. You can see in the molar region and in canine and premolar region. So now we will undergo the same procedure for maxilla like we have done in mandible. So we pass the eyelet wires between the 2 teeth. So I have passed it between the 2 teeth in the lingual side. And we will pull one side of the wire into the distal side and the other side into the mesial side. And now insert the distal wire into the eyelet. Twist it, cut the excessive wire. And in this way we have done for maxilla as well. We have taken 2 IV eyelet wiring in each quadrant. Now we have done the eyelet wiring for both the maxilla and the mandible. Now we will secure the mandible with the maxilla. You can see through these eyelet holes, through these loops we will take wires and secure it. Now pass the wire into the eyelet of the mandible and pass that same wire into the maxillary eyelet. So if you have difficulty, you can take the help of a probe so that you can insert the wire easily, and then both the wires are twisted together and then they are bent. Make sure that these wires aren't loosed when you are tying it. Tie it tightly. Cut the excessive wires and just tuck in both the wires in between, like in the video. Same procedure for the premolar and the canine region, the one we made IV eyelet. So here also you will just be passing through the eyelet tied together, and you have seen that in the maxillary premolar and canine are tied to the mandibular premolar and canine. Same way the maxillary molars are tied to the mandibular molars through the eyelet. Same procedure to be done for the other side of the quadrant. And in this way we are done. So now we are done with our IB eyelet wiring. I hope you really understood, and thank you so much guys for watching my video. Please do like, share, subscribe and comment. Thank you.